Hi. So a drain is a part and parcel of a lot of major procedures, and even in cosmetic surgery we need to use a drain sometimes. Typically for a tummy tuck or a breast reduction or any kind of large procedure such as a body lift, a drain will be part of your recovery journey. Now many of my patients get worried when they hear the word drain. Trust me, it's not that difficult to manage, and in this video I'm going to break it down for you and show you how to take care of your drain. So this is typically how a drain looks like. This is the tube which will be somewhere under your skin, and the part beyond this green thing is what is outside the body. This tube drains into a box here and collects the fluid, little blood tinged fluid which comes, sometimes yellowish straw colored fluid, and it will drain into the box here. Now when I send you home with the drain, your duty is to take care of the drain and measure it every 24 hours. You are supposed to let me know how much drained in this box in a period of 24 hours. I'm going to show you how to do that. Now, when a drain is emptied and then left free, this is how it should look. This box is like an accordion. It has to be completely pressed, and this is the tubing which goes into the body. Now, normally when we open this clamp is closed right now. When we open this clamp, this box should stay closed. That's the goal. That is what will create negative pressure here and allow the fluid to drain into the box. Now this is very important to understand, because a lot of patients will keep the drain, they will empty it, they will look after it in all every way, but this box has opened like this. What it means is that though the clamp is open, there is no negative pressure here. So the drain is not sucking the fluid which is supposed to be sucked out from under your skin. So now I will tell you how to charge or how to keep the pressure maintained in the drain. So first thing, presuming this is inside your body, the first thing you do is you clamp the drain. Alright? Then you open the jar in this way. So when this is opened up fully, you'll need help. So call somebody. He or she will press the drain fully for you and hold it there. Then you have to screw this back on. All this while, remember that the clamp is closed. Now you have to make sure that when you leave the clamp, the drain still stays closed. This is the most important thing when you're managing the drain at home. This will ensure that negative pressure is maintained and the drain keeps sucking the fluid from within your body. So that was about how to keep the drain compressed. I'm just going to explain how to look after this part. So remember that everything beyond this is going to be inside the body and there is nothing you have to do or worry about. This part is going to be outside the body. So make sure that these connections are tight. If there's only one tube here, make sure that the other side is closed tightly. Sometimes you may have another tube connected to this when there are two drains inserted. This tubing has to be clean and has to be kept clean, maybe just by using a cotton and some sanitizer. Just wipe it down once every day, make sure it's clean. When it comes to looking after your drain, make sure you wash your hands well or ask your caregiver to wash their hands. Maybe you can put on a pair of disposable gloves when you're handling the drain. The area from which the drain exits your skin, that needs to be cleaned with a small sanitizer, soaked gauze or swab. And make sure that you apply ointment around those exit points, the puncture points. And that should be covered with a small gauze piece and taped. Generally, you will not need to do this because you will leave the clinic or leave my hospital with all this done. All you have to do is keep the tubing clean it with a sanitizer once in a day, make sure these attachments are nice and tight, and make sure that you empty and charge the drain or make the drain filled with negative pressure every 24 hours and measure how much has come in the box. That's all you have to do, and you will be very comfortable managing the drain at home without any worry or fear. I have also had patients who carry this drain with them in a bag with the drain coming out of their bodies in a bag which goes on their shoulders and go out to the mall for shopping. Suppose they have come to India just for a week or 10 days and they don't want to be restricted. So that is also doable. However, be careful. Make sure nobody pulls or tugs on your drain or it doesn't get stuck anywhere. Especially if you're with children or with pets, make sure that nobody trips over this and yanks it out. That's all. Just look after your drain, make sure you empty it daily and make sure this is closed. Hope this helps. Thank you for watching.